This is an extract from the Leader Coronavirus Daily podcast by the Evening Standard and hosted by me, David Marsland. To hear the whole thing, search for it on your podcast provider. This could be the decisive move against coronavirus. Full-scale tracking and tracing of new infections by the end of this month. That's the government's new target, using an app that's been in development and tens of thousands of officials to chase down fresh outbreaks. It comes as testing heads towards the target of 100,000 a day, and our editorial column says it's a welcome shift in strategy.
Testing on its own won't beat coronavirus. It's what's done with the information that will make the difference. As we reveal today, the government's now aiming to have the app that's being developed to track and trace infection up and running by the end of this month. Apps have made a difference in other countries, but getting the technology right is hard. And even if it works, there needs to be a big, skilled team of people behind it. Doing this will be harder than testing people, but if it works, we will know we are beginning to win this fight.
Our political editor Joe Murphy is with me over the phone. And Joe, tell me about this app that's been developed.
Yeah, this app is going to be quite close to the one that they use in South Korea, where it's been enormously successful in helping tracking and tracing. And the big reveal in our paper today is a full tracking and tracing programme is going to be set up with a deadline of the end of this month. So that's just 30 days to get it going. And the app, it's very close in terms of technology to dating apps. Not that I would know anything about those, because a cold telephone in the hallway was my last dating tool. But it will tell you if you spent a significant amount of time in close proximity to somebody who later records as having had symptoms of coronavirus. And that will make you a potential carrier, and you'd be advised by the app to isolate.
So that could make an enormous difference to the UK.
It could do, only in conjunction with a very wide, broad policy that has humans, a large number, tens of thousands of people tasked with tracing and tracking outbreaks of the disease. This means that if you test positive for coronavirus, if you've been using the app, that will then send an alert to people that you maybe sat next to on the tube train or stood next to in a queue at the shops for a long time in close proximity. But also you will be interviewed by officials who will then try to work out where you've been in the last 5 days or a week, and speak to everybody that you would potentially have infected. So that could be friends or workmates if you were close to them and not socially distancing quite maybe enough. And in that way, everybody who could be carrying the virus gets isolated, made to take extra precautions until they're either confirmed to have it or cleared. And by doing so, you have outbreaks without question. That's inevitable. But you stop them from becoming epidemics again.
And this comes as it appears the government's hit its target of testing 100,000 people in a day. I wonder with that, because of the amount of pressure on Matt Hancock, I wonder if he's feeling some relief today.
Well, I'm told by somebody in Whitehall it is squeaky bum time for Mr. Hancock. As of the time of speaking to you, the figures have not yet arrived at the Department of Health to confirm whether or not he's actually hit the target of 100,000 tests carried out in a 24-hour period. They don't sound despondent, so I think he's confident that he's got the numbers. But in a sense, it doesn't really matter. The big picture is that capacity for testing, which was 10,000 a month ago, is now 100,000. And that makes possible something else. Not simply 100,000 random tests a day, but it's the capacity that can start this tracking and tracing, covering the whole country, mapping outbreaks, getting on top of them, much as the Germans have done to great effect with a fraction of our death toll.
on testing, you've spoken to Labour's new leader, Keir Starmer, and he wants to increase that target to 250,000 a day, doesn't he?
Yes, and that number actually is one that was first floated as a sort of goal, but not quite, an informal wish by the Prime Minister, although at the time he made clear that that would be using the antibody tests. These are the cheap put a pinprick of blood on a pregnancy test style bit of kit. Very easy to do at home, but unfortunately so far has proven too unreliable to issue. So the 250,000 target was what the Prime Minister was aiming for some time ago, but now Sir Keir Starmer has come in and said, look, 100,000 tests, that's just not enough. You need about that 250,000 figure. So he said to the Prime Minister, get back, embrace that figure and deliver it. And by the way, instead of recruiting 18,000 people, which is what the government announced a couple of weeks ago, to do tracking and tracing, Starmer says you're looking at 50,000 at least to carry it out. And how about enlisting some of those people who volunteered when the call went out for volunteers? Do you remember back in March, and 750,000 people stepped forward? A lot of them haven't had much to do.
Search for the Leader Coronavirus Daily on any podcast provider to hear more from the podcast.